has become, more than a habit. Yes. We are visiting with Janette Angulo, the Imperial County Health Director, and Chris Herring. And Chris, you're basically in charge of emergency response and so forth, right?
That's correct. I'm the Emergency Medical Services Manager here at the Health Department.
Okay. Well, I hope the county treated you better than my last employer did. Never got a raise. I just got an additional title.
We're treating him very well, Carroll.
Okay. So much going on right now. And, for an example, if you take a look at the Kxo website and our news stories, there are just so many things going on, not just COVID, but things. So, Janette, let's start with you. Yesterday, in effect, Governor Newsom issued a stay-at-home order, in effect, a curfew. And that will go into effect tomorrow night at 10. Do you see any changes in what's happening in the Valley with this?
Well, let's just briefly talk a little bit about the limited stay-at-home order that the state of California issued yesterday. And it was done because of the increasing rate of the cases. It's been increasing at a very rapid pace. There's also, besides the surge in cases, there's been quite a surge in hospitalizations. And this limited stay-at-home order applies to counties who are in the purple tier, and Imperial County, well, we've always been in the purple tier since this new blueprint was rolled over. And so what California is asking all of us to do is to stay home between 10 p.m. and 5 a.m. There are some exceptions, and you're right, it takes effect this Saturday, November 1st, until at 10 p.m. It remains back until 5 a.m. December 21st. So what the state is trying to do, what we're trying to do is to just, minimize the non-essential activities during, those times between 10 and 5 a.m. to, try to minimize the risk to individuals, try to, minimize the mixing from people, in different households, to just try to reduce the transmission of COVID. So that's truly what we're trying to do, implement strategies to help with this overall surge in cases and hospitalizations.
Okay. And on some of us, this isn't going to have a whole lot of effect. I'm done by 9 o'clock at night anyway, but according to the governor's office, okay, you stay out after 10, your inhibitions sometimes decrease. You might end up at a party for a lobbyist at a swanky Napa Valley restaurant and be out after 10, not socially distancing or adhering to the face mask provisions. And the governor wants to prevent that from happening, right?
Yes, Carol.
I just had to sneak that in.
Goodness.
It wasn't obvious, was it? A good number of state legislators in Hawaii for a conference as well. Okay. You're getting mixed messages, as is everybody from Sacramento getting messages from Washington. So it's made your job at the local that much tougher, the way I see it.
You know what, Carol? Sometimes we focus so much on what's happening everywhere else that we forget about our own. Let's remember, this is our county, community. These are our families. That's truly what it comes down to. And it's easy to point the finger, but no, let's look at what's happening here. Let's look at what we can do collectively to try to, get this under control. Our community deserves, access to resources. we deserve, the attention. Our families deserve to be safe and healthy.
Yes, and overall, in taking a look at things, for the most part, folks in Imperial County are very compliant, and that I do appreciate that. But
and yes, you're right. Come asking, it's not 100%, but the good majority are wearing a face cover when they're out and about. Sometimes it's not worn quite the right way, but it's okay. We're trying, and we just push out a few more messages. And let me tell you, many organizations, many community members, I receive emails and calls saying, Janette, you have our support. County has our support. We want to care for our families, our children. What can we do to help, during this COVID-19 response effort? And that's truly, truly appreciated. From the schools, from the hospitals to community-based organizations, just coming together, and moving forward in a very collective way. I think we're going to get out of this, and we're going to be well. Again, we just need to be united and sharing those, good safety messages and practicing.
That's one of the things about the Imperial Valley. We do come together and, look back at an earthquake on Easter Sunday, and the Valley took care of its own. And now that leads me to, you mentioned facilities and personnel, and we are getting help. El Centro Regional with what amounts to a 50-bed med-surg unit in the north parking lot. Pioneers Memorial getting an additional temporary facility. The alternate care site at IVC has reopened, and not just to handle the surge that we're experiencing now, but you and I both know there's going to be a surge after Thanksgiving as well.
That is correct. And Chris, you want to share a little about what's going on, the help for getting in Imperial County?
Yeah, and Carroll, just to kind of circle back to something you said, and it really does hit home in Imperial County. Our community is always really good at coming together to take care of our own. You mentioned the Easter earthquake. There's several other disasters that have happened over the years that jump to mind. Whether it's the Easter earthquake, we have these earthquake swarms every so often. Significant weather events and flooding. Our community has always done a really good job of coming together and working to get us through whatever we're facing. I think the biggest difference between those disasters and what we're facing with this pandemic as we go into month number 9 of our activation of all of our emergency procedures and our mutual aid system is it truly is an all-of-government approach. We not only have come together as a community in Imperial County, but we've leaned pretty heavily on some of our neighboring counties as well as the state of California. And I think everybody's done a wonderful job of stepping up to the plate to make sure that this community is cared for and we have the access to those resources that are required. You touched on some of the hospital build-out, capacity build-out that's been going on over the past couple of weeks at the 2 hospitals. That's something that couldn't have been done on our own. So that truly is the state of California showing that we are part of this as large of a state as we are, or Sacramento as we can be. We are still part of that important state of California government process that we've all built over the years. As far as the alternate care site, you're correct. That did open yesterday, and it accepted its first 2 patients yesterday. And if you remember that facility, the last time we opened it in May, it was open from May through middle of August. And we ended up seeing 213 patients there. Our hope is when we were going through the stages or the process of reopening that facility was we would put somebody in that college gymnasium again. But unfortunately, we've gotten to that point. But the fortunate news is, it is there. The resources are there to care for our community and provide that health care that's needed. I think the other biggest difference this time as we're, going into this round of holidays, and if you remember when we opened the ACS the first time, it was kind of a similar situation. It's the holiday weekends that compound on each other, in a short period of time, a week or two apart, that really do put a strain on our healthcare system. So there are plenty of resources that have come into this community to help support that existing framework that we already had in place, and really, back up our local healthcare providers and our local first responders that have essentially been in the trenches for 9 months working to keep this community moving forward.
Okay, one other thing, and I know the healthcare system already spread thin, but coming up next week, Thanksgiving, and we won't go into the family spread that is liable to happen, but Thanksgiving weekend or even full week sees a huge influx of people to the desert, and this puts a strain on the healthcare facilities as well. So you're geared up for that?
That's correct, Carol. And it's been a couple of conversations with the state of California on how to best manage that influx of visitors that come into our community. I think it's been pretty eye-opening for those folks up in Sacramento. The initial conversation they were talking about, planning for the Thanksgiving holiday. And, when we got into explaining and really laying out what goes on, it opened their eyes that it's not just a one-day event or two-day event that takes place out in our desert. It really is, there's already folks out there. I want to say they probably started rolling in last week.
I started last night trying to get through the interstate 4th and the freeway in El Centro was a joy.
So we are actually working with the state of California. Again, this is the EMS who really is responsible for the medical mutual aid across the state. But we've been working with the EMS Authority and the Bureau of Land Management. We're actually working with them to establish what would amount to kind of an urgent care center, essentially in the Glamis area, to help take some of that burden off of our local hospital, so that folks who have some of the more minor injuries, small cuts, lacerations, bruises, stuff like that, from the minor injuries that just happen as part of the recreation that goes on out there, can be seen and treated without going into our emergency departments and adding that extra patient load. With that being said, obviously those patients that do require more advanced medical care, it does free up a little bit of space for them to seek treatment in our hospital.
I'm not sure what the level of the number of beds that are filled at both hospitals, but not only is there COVID, but there's the regular flu, if it is anything is regular these days, as well as cardiac conditions and asthma and other issues. This time of year, the census at the local hospitals is typically rising normally. So that's having a serious impact on the local healthcare facilities as well, right?
It is, Carol. And one of the things that we saw with the first round of COVID, a few months ago, people were delaying care. They were avoiding going to the hospital when they were having chest pain, and they were kind of downplaying the symptoms of some of these other serious medical conditions. So, one of the things that we're trying to push the messaging out as part of all of this build out not only are we, increasing the capacity of our hospitals to care for COVID patients, a lot of this work is actually being done to make sure that those patients that do have those other conditions, whether it's they're having a heart attack, a stroke, an asthma attack, they have space, they have capacity in the hospital to care for those patients as well.
Life does go on. So, and that's one of the things that I know physicians are doing an awful lot through telemedicine, but, people need to be aware, okay, I can be safe going to the hospital. I've got chest pains or a possible stroke. I better go. That kind of all gets caught up in the middle.
It does, and that's been one of the key messages that our hospitals, and we've been trying to deliver, is our hospitals are open and able to accept those patients. If you are experiencing any of those other medical conditions, don't delay seeking care. Delaying care is only gonna make it harder for you to recover and harder for the medical staff to treat you.
Okay, Janette, anything to add? I know you guys are extremely busy and moving in about 48 different directions, but flu shot clinic tomorrow.
Flu shot clinic tomorrow, Carroll, at the Imperial County Fairgrounds from 7 a.m. to 10 a.m. It's at no cost. It's drive-through. We're asking that the community wears a face cover and highly, highly encouraging them to wear a short sleeve shirt. So lots going to go on tomorrow. We're hoping to see at least 1,000 people. At the October 31st clinic, we saw over 1,300 in a 3.5-hour span of time. So, yes, that's tomorrow, Carol.
Okay. And with that, Chris, Janette, have a very safe and healthy Thanksgiving. And, keep up the good work.
Thank you, Carol. Take care.
You as well.
The best